be a tube of contact solution, for example, potentially. And that's because the saliva itself, as the person asked, can be very it can be different textures, it can be different consistencies, it can come from different niches of the oropharynx or respiratory tract or the mouth. And so in that sense, I would say that it does lead to some significant variability. That said, there are potentially like instruments that you could put right under your tongue, for example, to pull virus out in a slightly more consistent way each day. Um, and different approaches. I would say that the jury is still out there in terms of what is the best approach for getting the best saliva type of specimen, and it seems pretty variable.
Mm-hmm. You have spoke about this question a bit, but I want to come back to this. Is how amenable are these paper tests to the massive upscaling required to make them a key component in track and trace or other frontline settings like hospitals, care homes, and airports? And again, I know you spoke about this a little bit, but do you think this paper antigen test, the technology is such that we can really scale this the way we need to?
I do. I think it much more than any of the other options that are on the table. These are tests that even a startup company partnering with a smaller manufacturer can make millions a week, and millions a week is essentially the limit of the major companies right now. And so yes, I think that the scale can be huge here. Um, One of the beauties of this is, we talk about test and trace and things like that. One of the real beautiful things about this kind of test, at least from a public health perspective, is if everyone's doing these tests, you can almost get rid of contact tracing because everyone would essentially, you're getting cases, so you're breaking so many transmission chains early that if you go and infect somebody else, that they're most likely going to be testing anyway, which is all a contact tracer would do.
Yeah.
So if everyone has the test and everyone's testing, and so you don't, from a public health perspective, you don't have to use contact tracing as the way to identify potential other positive and at-risk individuals because everyone else has tests in their pocket that they can use. So it really changes the game. It changes everything about how we've been thinking about the approaches that we take to this epidemic. And that's because all of the approaches that we've taken so far are sort of based around the assumption that we couldn't be testing everyone daily, but we have an opportunity to be able to do that.
Another quick question. We got to let you go here soon, Dr. Mina. This is from a nurse, and it's kind of a long question, so I'll just abbreviate it to say, why are labs not required to report CT values with positive results if we now know to some degree infectious thresholds? And she goes on to describe how that could be really useful for skilled nursing facilities, for PPE conservation. Do you know why labs aren't required to report that information?
I know well. I run one of these labs, and so yes, they're not allowed to. It's not that they're not required to. It's that they're legally not allowed to report them in any standardized way. And we do it all the time. Labs do it all the time offline, if you will, where a physician calls up and they say, my patient's been positive twice. What were the CT values? And I've actually published one paper a couple of months ago in Clinical Infectious Diseases, CID, on this particular issue of that we really should be reporting the CT values. And this is a different issue. I have a whole sort of area that my lab works on now, which is all around how much more power there is in the CT values if we just made it available for public health, to contact tracers. The individual person who's infected may or may not be able to use it very much. But if you ask me, a CT value of 40, if your first diagnosis is made and you've felt pretty good, and it was just on a screening test, and you have a CT value of, let's say, 37, Well, at the moment, that's just going to show up to you as a plus. You're positive, and then you're going to have to go in quarantine for 10 or 14 days. But if we actually gave you your CT value and I said to you, look, your CT value is 37, there's a small chance that it happens to be a really low viral load and it's on the way up.
Hmm.
And so it'd be really crucial to know that. But the vast majority of CT value samples that are caught at a CT value of 37 or a very low viral RNA copy number are going to be actually weeks past.
Oh,
Am I still here?
lost you,
Okay.
lost you for a moment. I think the last thing I heard was you said at the tail end of the infection, you're going to be likely. That's when you're likely going to pick up these really high CT values, low viral loads, and then I think I lost you.
Yeah, so that's exactly right. And so what I would suggest that we do is, which I think this person is intuiting, is that we specifically say what the CT value is, and every time there's a positive person is detected, you wait 24 hours and you test them again. If their CT value has gone from 37 to 20, you know that they need to be quarantining for 14 days. They're infectious. But if their CT value goes from 37 to 37, and doesn't change at all, you know that they are past their infectivity and they probably, despite having just been diagnosed for the first time, it's too late, that you've already missed it and they don't even need to quarantine at all. So there's a whole efficiency gain for society here if we are currently quarantining millions of people for no reason. And if you look at the average CT value, just as an example, in Massachusetts right now, the average CT value is like 36 or 37. Even the interquartile range is all above 30.
Wow.
So that means almost every specimen, almost every person that we currently diagnose and ask to quarantine for 10 or 14 days right now in Massachusetts, and this is across the whole country, well, not in Georgia and Texas where infections are raging. There's a lot of people who are getting caught infectious there, but are generally being quarantined what I would call erroneously. They don't actually need to self-isolate and quarantine for 10 or 14 days. Unfortunately, we've already missed their positivity. And then we take it one step further to really push home the reason why we should be reporting out CT values at the very least to contact tracers. Anyone who has a CT value of 37 already doesn't need to be contacted. It's a waste of time for a contact tracer to go and trace them 2 days before they got their swab because they probably were infectious 2 weeks before they got their swab. So you're contact tracing the wrong people and spending millions of dollars to do it. There's just, I could continue pointing out the flaws in our surveillance system, but it's why these are all really good questions, and they are the reasons why we are currently failing to control this virus, because we have all this regulation that stops these normal things that should be going on, like reporting out CT values.
Right. Well, we know you're doing everything you can with your research and with taking interviews like this one and being featured in articles. What can we do? What can our viewers do, whether they're a clinician or a non-medical person, to help move this along and continue momentum for this?
Yeah, I think there are different things that people can do. I think one thing is there's been a number of different templates, and I can send you one after this, different advocacy groups that are kind of getting stood up around this to help people write letters to their, with a press of the button, you can send a letter to your congressman or senator. In the TWIV interview at the end, I said, get in touch with me to help, but that was a bad idea. I've gotten too many. My inbox is extraordinarily full every day now. So don't write to me probably, and I probably won't respond. If you do, I apologize. But what we can do is, I think after this, I'll send you a link. I think you could probably put the link on maybe down below the video or something.
Yeah.
Or that people can click on, and this will be, there are different links that go to different advocacy sites, and some of them that are getting stood up do allow they give some more information. We're building out animations. There's been kind of a whole army of people that are getting involved. And maybe in the link, if people want to get more involved with these groups rather than just sending a letter, there will be some contact information there. And there's a lot of momentum. It is, as a public health person and a researcher, there's few opportunities, I think, and as individuals out in society, I think we have few opportunities in life to truly change the course of an epidemic that's killing, potentially eventually millions of people on Earth, and continuing to infect millions of people just in the United States here. And I think that there's an exciting groundswell of support, and I encourage people to get as involved as they can, because as much as you'd be supportive of helping to push vaccines through, if the government wasn't already pushing that very hard, I think we should all be considering this with the same urgency that these things need to get pushed through as much as any vaccine, and it's just not as readily palatable by the politicians and everyone. And so I think the more support we can get, the better.
Well, speaking of vaccines, I know you've done a lot of research around vaccines. We'd love to have you back sometime to talk more about vaccines and also get an update on what's going on with COVID-19 testing. Hopefully, next time we chat with you, if we have that opportunity, we're in a much different place than we are now. And
I really hope so too.
But so I can say on behalf of all of our viewers and us here at MedCram, thanks so much for your work, Dr. Mina, and the leadership that you've shown with this. We really appreciate it. And any final words before I let you go?
No, just spread the word. I think Twitter actually turns out to be a really powerful tool to get people to recognize just how important these issues are, and Twitter and other platforms. So it's amazing. I just want everyone to recognize that every little bit is truly helping here to push the political will towards changing. And these are mountains that we're trying to move from a regulatory perspective, and it's working.
Yeah.
So I just want people to know that.
For people that want to follow you on Twitter, what is your Twitter name or handle, I guess it's called?
It's at Michael Mina _lab.
Okay.
So we can maybe put that in the description or something later.
Excellent. Well, thanks so much, Dr. Mina. I'll let you go and get back to your important research. And thanks again for joining us today.
Absolutely. Thank you.
And to everyone watching this, thanks again for tuning in.